And we are recording. And I'm delighted to have with me today Chris Palmer, MD, who's a Harvard psychiatrist working at the interface of metabolism and mental disorders. He's also the author of Brain Energy, which is coming out in November this year, 2022. Welcome.
Thank you. It's great to be here.
Thank you so much for coming on. I've been following what you've been doing for some time, and I was saying just before we started how important mental health is for me. Anyone who's followed me for a while will know that. And I love what Georgia Ede, a fellow psychiatrist, said that studies have shown conclusively that the head is in fact part of the body. And I wonder if you could just talk a bit about your background and how you came to where you are just now.
Yeah, it's a super long story, but so I am a psychiatrist at McLean Hospital and Harvard Medical School. I have been there since 1995, so 27 years now. And my regular job is I actually do a lot of things. So I'm the director of a continuing education department. So I oversee educational conferences for mental health professionals from all over the world. I have also conducted neuroscience research for about 20 years, focusing in particular on the issues of addiction and sleep, but also their relationship to other mental disorders. I have always maintained a practice of psychiatry as well. And the people that I tend to work with tend to be treatment-resistant patients. So I almost never see anybody off the street with new onset depression or even new onset schizophrenia. I see people after they have been in and out of hospitals. They've usually seen at least 4 or more mental health professionals before they get to me and are not better. And I see them in that case. Oftentimes they've tried dozens, sometimes they've tried dozens and dozens of medications. Some of them have had most of the treatments that we have to offer. And then it's my job to try to sort through all of that and figure out what can we possibly do to help this person get better. My career took a little bit of a turn. It's well over 20 years ago. I began using low carbohydrate and ketogenic diets in patients with treatment-resistant depression, anxiety, personality disorders. But I wasn't really publishing that work. I wasn't out on the speaking circuit about that work. At that point, even today, low carbohydrate and ketogenic diets are kind of taboo in the general medical space and general medical field. And 20 years ago, they were even more so taboo. As some people in this space know, there are physicians who have lost their licenses over prescribing low carb and keto diets. So I didn't want to join them. I was just kind of keeping it quiet on the down low, helping patients one at a time. That all changed for me about 7 years ago when I was helping one of my patients with schizoaffective disorder, which is a cross between schizophrenia and bipolar disorder. When I, put him on a ketogenic diet to help him lose weight. Even though I had been using this for depression, anxiety, I would, if you had asked me at that time, do you think this could help schizophrenia? I would have said, no way, not a chance. Schizophrenia is a serious brain disorder, debilitating, hallucinations, delusions, people are disabled, our treatments are awful. Nobody knows what to do for these people. Will a change in diet help those symptoms? Not a chance, I would have said. even though I'd been using it for 15 years at that point and seeing it work for treatment-resistant depression. Depression is very different than schizophrenia. And lo and behold, I watched, over the first 2-3 months of this patient starting the ketogenic diet, I watched a progression of events. He became much less depressed, less sedated, started waking up, started making more eye contact. I wasn't changing any of his meds. His meds were exactly the same. All he was doing was the ketogenic diet. He began losing weight. And within about 6 to 8 weeks, he started spontaneously telling me that the voices that he heard every day for the last 13 years were starting to go away, and that his longstanding paranoid delusions were going away. And that he started realizing, you know what, I don't think those things are true, and they probably never were. Like, now that I'm thinking about it, they sound kind of crazy, right? Well, maybe I had schizophrenia and that's why I was thinking those kind of crazy thoughts. Like, what's going on? What's happening? At that point, I was really dumbfounded and flabbergasted. I actually had to ask some colleagues who were working with this same patient. I asked this patient's father, like, are you guys seeing what I'm seeing? Because I'm having trouble believing what I'm seeing. This does not happen in psychiatry. They were all equally dumbfounded, like, yeah, what's going on here? He's getting better. Like, this is like a miracle. What the hell is happening here? I quickly dove into the medical literature, found out about the ketogenic diet and its use in neurology as a treatment for epilepsy, which I did not know really at that point. Even though I'd used it, I was using it as like the Atkins diet, low carb, weight loss, maybe diabetes. I knew about, there's no maybe about it. I knew about it solidly as a diabetes treatment because I used it with both my parents for their diabetes. But I didn't realize that it was used as an epilepsy treatment and that it could stop seizures. And so that led me to using it with more and more patients. It was effective with most of the patients that I was trying it with who could actually do the diet. I started publishing case reports. I helped a research team in Ecuador. We did a pilot study of 2 patients with schizophrenia there, published more case reports, consulted with Dr. Eric Westman about one of his patients who had long-term remission of schizophrenia. And that really kind of launched a very different career for me. And I still have my day job. I actually don't get paid a penny for anything related to the ketogenic diet. This is all just extra work I do. But that has been my claim to fame, and things have really taken off since then. I'll stop there because I could just keep talking and then you will never get a word in edgewise for the whole hour.
Oh, I mean, it's fantastic to hear about that patient and about, the application of the ketogenic diet to treatment-resistant depression as well. As you say, it's been used for 100 years or so on epilepsy. Less so now, I think, because of the drugs available. And I think something like a third of treatment-resistant epileptics do really well on the ketogenic diet. I don't think it works for everyone. But you already anticipated a question of mine. I could have asked you about the most sort of miraculous seeming transformation you'd seen. But of course, we see spontaneous remission in individuals of all sorts of illnesses like cancer, even. All that side of things kind of spurred on, immunological therapies where the original case, maybe someone's been infected by a virus or something, and then their immune system has done something which has resulted in remission. The anecdotes are inspiring and, of course, highly suggestive of a cure, but sometimes maybe consistency is more important. And you suggested that treatment-resistant depression seems to be consistently responsive to a ketogenic diet. What about schizophrenia? What about others? Have you noticed that there's the same consistency? Does it vary in consistency? What do you think?
So in my experience, it does vary in consistency. The two disorders that I have had the best luck with, but it may just be my sample bias, just the patients that I happen to be seeing. But the two disorders that seem to respond best are schizophrenia and bipolar disorder. It can dramatically reduce symptoms, and I have seen many cases now of remission, where people are even able to get off medications and remain symptom-free. I call that remission because, to the best of my knowledge, everyone that I've worked with or that I know of has had to remain on some kind of a special diet. They don't always remain on a ketogenic diet, but they certainly remain on usually a low carb diet, something. And sometimes the symptoms will start to show signs of coming back, mild mood changes or sleep changes or something else. And then they get back on the ketogenic diet for a little bit. And so from that standpoint, I don't use the word cure, because a cure would mean they could go back and eat the standard American diet, just like everyone else who doesn't have schizophrenia, and they would be cured. And I have not yet seen that. It's possible that may come and it may happen. I have to say, with chronic depression, I have had several patients who did not get better. And I think that is because depression in particular is a complex disorder that can have many different root causes. And they can be biological, psychological, or social. And for some people, the psychological and social causes are profound. So for some people, they have no friends, they don't have jobs, they're disabled, they don't respect themselves as a result. They don't feel like they live up to society's expectations of what a human being is supposed to be, have chronically low self-esteem. And the ketogenic diet may not address those issues. And if it doesn't address those issues, that person may still have depression. It's not to say that it can't work for depression, because I have seen it have dramatic effects in treatment-resistant depression. I've even seen patients get hypomanic from the diet, which is kind of the opposite of depression. They get really happy. It's something that happens commonly with antidepressant treatments, and even a treatment like ECT. With those biological treatments, we not uncommonly see hypomania as part of the treatment pattern. And in my view, that makes me take the ketogenic diet actually much more seriously. It's like, well, this is doing exactly what antidepressants and even ECT are doing. It's a biological treatment. We know a tremendous amount about this diet from the neuroscience literature and from neurology and the epilepsy field. So we know that this diet is changing neurotransmitter systems. It's decreasing inflammation, and in particular brain inflammation. It's improving insulin signaling, improving insulin resistance in the brain even. It's changing the gut microbiome and having potentially beneficial effects through those gut microbiome changes. And it's doing many, many other things. So we have lots of very plausible biological reasons why this diet might actually be alleviating symptoms of serious mental disorders.
Yeah, you've anticipated more of my questions. Around schizophrenia, you don't want to use the word cure, and I guess I understand why, but if the definition of schizophrenia was an interface, a negative outcome from the interface between the standard American diet and genetically predisposed individuals, then you would be okay to call it a cure, I would imagine. But is that a fair definition of schizophrenia?
I don't think it is. Schizophrenia, all the mental disorders, schizophrenia included, have numerous causes. And we know a lot, or numerous risk factors is what I should say. We know a lot of those risk factors. So for instance, it can be as simple as if your mother had an infection in the second trimester of her pregnancy with you, that puts you at elevated risk for developing schizophrenia. If you then went on as a 5-year-old to develop a severe infection with whatever, virus, a bacteria, whatever, and you were hospitalized for that infection, you are now much, much more likely to develop schizophrenia. You're also more likely to develop lots of other mental disorders like OCD, like autism, even at that later age, and other disorders. But schizophrenia is among the disorders that you are more likely to develop. Your mother having an infection when she's pregnant with you and you developing an infection when you are a child has nothing to do with diet, as far as we can tell. Now, some in the diet community might want to say, well, if they were eating a healthy diet, they wouldn't have ever gotten an infection to begin with. I wish life was so simple. I know lots of people who are keto, low carb, who have gotten COVID, for instance.
Me, twice.
So I personally do not believe that following a proper diet, whatever proper diet you think that is, confers immortality and invincibility. I just don't believe that. I'm waiting to see the person who is immortal and without any disease whatsoever because they are following the perfect diet. I wish life was that simple. I wish medicine was that simple. It's not. And then you add to it things like bullying and teasing, abuse, sexual abuse, physical abuse as a child. Those actually confer risk for not just anxiety, depression, PTSD, they actually increase the chances that somebody will develop psychosis. So if you have this kid whose, mother had an infection, he had an infection, and he also lives in a really crappy home and he's getting beaten up and the kids at school bully and tease him, he's really developing lots of risk factors for, developing certainly depression, anxiety, PTSD, but also schizophrenia. And those things have nothing to do with diet. He could be keto and kids could still be mean to him. He could be keto and his father could still beat him up. Keto has nothing to do with whether you're living in a hostile world. So there are lots of things that go into the development of mental disorders. But diet is an important one. That's kind of my claim to fame. I'm not disowning it. But I don't want people to come away thinking Chris Palmer says a keto diet can cure everyone, because I'm not at all saying that. What I'm saying is that there are lots of things that go into the development of mental disorders. Dietary interventions can be really powerful. And I look at it very differently. A lot of people think if going keto helps a disorder, then it must be the carbohydrates that were the problem. So if everybody just got rid of carbs, the world would be happy and healthy. I don't see it that way. I actually see the ketogenic diet as a metabolic intervention. It is profoundly changing metabolism throughout the body and even in your gut. And those changes can confer profound benefits and adaptations to the way your body and brain function. And so I think about the ketogenic diet in particular more than really any other diet, more than like the Mediterranean diet or vegan diet or vegetarian or paleo. Those diets are really more about which foods are healthy and which ones aren't. I actually see the ketogenic diet as something very different in a league of its own. It is mimicking the fasting state. It's profoundly changing metabolism, and that can have tremendous benefits on brain function.
Yes, I guess your observation that it works quite reliably for schizophrenia and perhaps not so reliably for treatment-resistant depression. Is that, just to clarify, that's what you said earlier?
Yes.
Yeah. That it seems like the component of cause might be more likely attributable to diet for schizophrenia. I mean, one could say there's a confounder in the prediction that if someone has adverse childhood events, that they're more likely to develop schizophrenia. It might be because that they're more likely to binge eat junk food because they feel like shit all the time mentally. I mean, it's just, it would just be a theory, but, I'm thinking about papers like, if is schizophrenia rare if grain is rare, this observation from the 80s that in somewhere in the South Sea Islands, or maybe it was Papua New Guinea, the rate prior to westernization of schizophrenia was like about more than a 50th less. So there was maybe 2 cases where in the West you might expect 120 or something. And then after westernization, the rates came up. And of course, one might say, well, maybe there was abuse, societal breakdown, and so on. So there's a confounder there too. But there's pretty good interventional studies about removing not carbs, but gluten. And I wonder if that's something that you've looked into much with schizophrenia particularly. And maybe we could talk about gut health after that.
Well, it's a perfect segue into gut health. So, so if gluten is a problem for a person, it usually is going to relate to gut health. So the extreme form of gluten intolerance is called celiac disease. It's an autoimmune disorder in which people really do not tolerate gluten, and their GI tract can become inflamed in response to gluten. The inflammation in the GI tract can lead to permeability. A lot of people call it leaky gut. And that has a whole host of problems in and of itself. But the inflammation itself is a major problem. So inflammation on its own is a problem to human health. And, I cited the 2 studies. If a mother has inflammation, that can adversely affect her child. If a child has inflammation at a young age, that can adversely affect brain function shortly thereafter, within 3 months of hospitalization for an infection. So if gluten is causing inflammation, the inflammation on its own is a problem. But then you add on to that the inflammation is happening in the GI tract. And the GI tract is really essential to human life. We don't think of food and water as being so critically important to human health because we just take it for granted. Like it's there. No, at least in the Western world, very few people are starving to death. But in fact, we are organisms that rely 100% on food and water. If we don't get food and water regularly, we will die. And so our entire survival depends on it. And the GI tract is where all of that is being processed, broken down, and absorbed. And but the GI tract is also a site where the body is preparing to take on those nutrients. So even before the food reaches your stomach, as soon as you taste something sweet on your tongue, a signal gets sent to your brain. Your brain actually kind of commands the pancreas to start releasing insulin because it knows, or it thinks it knows, that carbohydrates, sugar is coming. And so it prepares for that sugar to come. Now this gets confounded because you can have artificial sweeteners. So you're fooling the brain. The brain thinks sugar is coming. It still causes that insulin release, but sugar isn't coming. That can end up being problematic. But anyway, so if the GI tract is inflamed, it can result in malabsorption of some of those nutrients. It can result in malabsorption of vitamins and minerals that are essential to health. The leaky gut can allow things to leak into the bloodstream that should not be leaking into the bloodstream. Those things can cause even more inflammation. So now you got inflammation on top of inflammation, and it can be problematic. And then the gut actually talks to the brain in at least 3 very profoundly different ways. There's a nervous system that's connecting the gut and the brain, the parasympathetic nervous system or the vagus nerve. The gut cells, the cells lining your gut are actually secreting hormones and neuropeptides and other things, again, preparing the body for these nutrients that are coming, but also preparing the brain, telling the brain, like, I've had enough, I'm stuffed, don't eat anymore. So they're controlling feeding behaviors and other behaviors. And then the microbes within the gut are processing all of this food, and they are secreting hormones and neurotransmitters and all sorts of things that are getting absorbed into our bloodstream and having widespread effects on our metabolism and brain and health and all sorts of things. So it gets really complicated really fast.
Yeah, totally. And some people like me love hearing about that and soaking up the information. Originally my degree was in physics, and that was what I was doing before I started getting more interested in nutrition. But some people just want a simple heuristic to get them through, the rest of their lives. And I think that's why keto is so popular, because they just have to keep the carbs low. And I wonder, how deep do you go with people? And something you see very often, and I quite like seeing, because I think it's good belt and braces advice, is avoid sugar, flour, and seed oils. What do you think about that statement, and how do you go about it?
Avoiding sugar, I think, is reasonably good advice. I really don't see any benefits in sugar other than just the pure addiction, enjoyment, pleasure of eating things that taste really delicious. Now, a lot of people who are eating a lot of sugar will listen to somebody like me and think I don't know, I'm crazy. I can't possibly know what, maybe my parents raised me on no sugar. No, so just to let people know, I used to definitely be addicted to all this stuff. I would eat sugar all the time as much as I wanted, because at the time that I was kind of really thinking about nutrition, it was all about fat. As long as you avoided fat, you could have all the sugar you wanted, and that was healthy. So you could have candy, you could have Entenmann's, low fat or no fat, pastries, and those were a health food. They really were. Turned out that wasn't probably accurate. Well, I should insert the probably. It definitely was not accurate, and it was horrible for my health. And that's what ended up leading me to a low carb diet. So no sugar, I 100% agree with. No flour, that starts getting a little more complicated. As a rule of thumb, I don't eat flour. I haven't eaten flour on a regular basis for over 25 years. So for me personally, that's a good motto. I adhere to it. Should everybody avoid flour, especially if we're talking whole grain kind of flour? I'm a little more reluctant to say every human being on the planet should avoid flour. I don't feel 100% certain about that, but if I'm prescribing a low carb or ketogenic diet, absolutely, they're going to avoid flour, and that's one of the things they cannot have. So that's just, If we're trying a metabolic intervention, is the way I like to think about it, they should not be having flour. I will be honest with you, the seed oil issue is the one that is the most controversial to me. And it may not be to a lot of other people in the audience. I get it. I know that some people are 100% certain. There are some people in the low carb keto community and other communities will say seed oils are the cause of what ails us. If we just got rid of seed oils, everybody would be healthy. I am not 100% persuaded by that. I am persuaded enough that I do not eat seed oils myself. I will tell you that. I avoid seed oils like the plague. If I do have seed oils, like which would be in the context of going out to a restaurant, having something that has like salad dressing on it, or was fried, or something that I know that it's probably seed oils. Do I notice a difference in my health at all? Do I feel more inflamed? Do I notice like I gained 2 pounds in 24 hours, and I usually don't gain 2 pounds in 24 hours? I do notice differences in those things. I notice much more weight gain the next day. I weigh myself every day, every morning, just to see what's going on. I don't obsess about it. I don't really think too much about it, but so I usually know what's happening with my weight. It's usually relatively stable unless I'm trying to build muscle and bulk up or go down. But what could be a stable weight can become unstable if I eat seed oil, if I have seed oils. So that's concerning. I'm aware of animal research. So these are rats and mice, that it can impair metabolism. It can impair mitochondrial function in particular, which is something that is of particular interest to me. And that is concerning, but those are mice and rats. Mice and rats eat different diets than humans. And like if you look at a rat out in the wild or a mouse out in the wild, they are eating a somewhat different diet than a human being would be eating. And it's not clear that the way a dietary intervention or a dietary ingredient affects a mouse is going to be identical to the way it's going to affect a human. We also have to look at mouse studies. Mouse studies have all sorts of problems. Mice are nocturnal animals. They have a completely different circadian rhythm than we do. And yet laboratories studying them are often studying them during the day because that's when humans are awake. So it would be like studying a human being eating at 2 a.m. Your physiology is completely messed up if somebody's waking you up at 2 a.m. and trying to get you to eat. Your hormonal systems are off, your circadian rhythms are off, and all of that affects how we metabolize foods. So I always take mouse studies, at least with a grain of salt. And I have not seen compelling, convincing, randomized controlled trials of seed oil interventions. So seed oil or no seed oil with hard outcomes. Like if I take 5,000 people, half of them get seed oils, half of them don't get seed oils. Do we see a difference in the rates of cardiovascular disease? Do we see a difference in the rates of obesity? Do we see a difference in the rates of depression or schizophrenia? To the best of my knowledge, I could be wrong. And if any listeners want to correct me, hit me up on Twitter and show me the articles. I am not aware of any good randomized controlled trials looking at a seed oil versus non-seed oil intervention with clear differences in health outcomes. That study would be easy enough to do. It would be costly, but it would be easy enough to do. So if the powers that be were really 100% persuaded that seed oils are toxic to human health, they should have done them. I mean, the powers that be do studies like that. I mean, we have now banned trans fatty acids for that reason. Trans fats are toxic to human health. We have pretty good evidence of that. So those are banned. Unfortunately, the issue with seed oils gets really complicated because people like Walter Willett, who is a leader in the nutrition field, is saying seed oils are great for everyone. Everybody, it will decrease risk of cardiovascular disease. Everybody should be eating seed oils. Don't worry about that ratio. Everybody talks about that ratio, omega-3 to omega-6 fatty acids and all that. Don't worry about the ratio. Just eat seed oils. Eat them in abundance. They're great for you. So we've got people like him saying stuff like that. So we're a long way away from clarity on this issue, is what I would say.
Yeah, I would agree completely. I think I'm fairly convinced. From a mechanistic point of view, there's lots of good stuff on the blog Hyperlipid. I don't know if you're into that blog at all. Peter Dobromilski's been on the podcast. He, if you really want to nerd out, there's a thread called Protons, which kind of takes the electron transport chain from the very basics all the way through. And I think when I read that for the first time, it became clear to me why seed oils aren't good for metabolism on that level. And then there's all sorts of other studies about 4-HNE and the other toxic breakdown products that seem to exist, especially in the presence of glucose. The list goes on, and like you say, lots of mouse studies, but it would be great to see a very clear intervention study that does what you just said. And so bring it on, I say. Something around health coaching, which another health coach asked me to ask you, and I had in my head as well, was you must find skepticism from people suffering with mental health conditions around the plausibility that changing their diet will help them. It's something that I find, with even people who've come to me as coaching clients. Have you found much resistance? And do you think that means that we're not actually very good at identifying what motivates our feelings in the moment, which I know is maybe a big separate question, but yeah, what do you think about that? People sort of dismissing out of hand that diet might help, or lifestyle in general, because I know you've said it's not just diet.
It's a great question. And so that is one issue that I am particularly passionate about and I am focused on. So since I've been doing this work, I quickly recognize people in the diet community are getting nowhere. It's just nobody's listening to people. Nobody's taking them seriously. We are not seeing these interventions in psychiatric hospitals. We are not seeing these interventions in mainstream psychiatry offices. That's my goal. So for the last 25 plus years, I've been educating mental health professionals, the traditional hardcore ones that come to Harvard conferences because they want the best education. I want to educate all of those people on how they can improve patients' symptoms using the interventions I talk about. So I am going about it in a different way than a lot of people in the diet community. Some in the diet community may not like me for that, and that's okay. A lot of people don't like me for lots of reasons, I suppose. So that's okay. I'm okay with that. But I'll at least explain why I take the tack I do. So some in the keto community get frustrated with me or even upset with me because I explain things. I didn't jump on the bandwagon of seed oils right away. Like the last explanation I gave a long-winded explanation, which is really I'm not really sure. And that's frustrating for a lot of people because they want me to be part of the team. They want me to, why are you, Chris Palmer, why aren't you joining us? And I want to say, at least to the people in the low carb keto community, I am joining you, but I am pitching my message not to you. I'm pitching my message to mainstream medicine, and it's a different message. And so the first thing that I think sets me apart is I have not presented the effectiveness of the ketogenic diet in the treatment of bipolar disorder, schizophrenia, or chronic depression from the stance of a weight loss diet. Definitely not from the stance of a weight loss diet. Like if you lose weight, that means you're eating healthy, and if healthy body, healthy mind. That's the way a lot of people think about it. That doesn't go very far in the mental health community, because people in the mental health community are like I was 7-8 years ago. Like these are serious brain disorders. Like this isn't just like, oh, it would be nice if we could help patients lose weight. This is a very different issue. These are brain disorders that are ruining people's lives, that are driving people to kill themselves, that are driving people to drink or use drugs. I mean, people are tortured by these symptoms. This is not a silly laughing matter. Like this is not about you with your diet advice. So instead, I glommed on to the neurology field and the epilepsy field. And it's just so nice and fortunate for me that they were there ready and waiting with an abundance of neuroscience. And so when I talk about it, I always talk about it not as a diet, but as a metabolic intervention. And I say this metabolic intervention can stop seizures when medications fail to. That almost always gets people's attention. They're like, what? What are you talking about? That fad keto diet? I'm like, no, the medical ketogenic diet. I even sometimes insert the word medical ahead of time. That gets you more respect. People take it more seriously if you call it a medical intervention. So it's a medical ketogenic diet, or it's a metabolic intervention that stops seizures when everything else fails. So that gets people's attention. And then I quickly point out, oh, and by the way, we use epilepsy treatments every single day in tens of millions of people in psychiatry. We use them like candy, actually. Depakote, Tegretol, Lamictal, Topamax, all the benzodiazepines, Neurontin, all of those things are anticonvulsants. That really gets people's attention, because if they are a mental health patient, or if they're a family member or a clinician, they're like, oh, well, yeah, now that you're saying, yeah, now you're speaking my language. Yeah, we use those pills all the time. And sometimes they work. And then I say, and yeah, and when those pills fail to work, this diet can work. It can stop seizures.
And I guess they're not necessarily even interested in metabolic mechanisms which they have in common or anything like that. It's just a very simple logical flow diagram with authority.
So that's where I start. If they want the metabolic mechanisms, I quickly go into that. And, again, the neurology field has just handed me on a silver platter, like all of these great diagrams, mounds of research, decades of research demonstrating this diet changes neurotransmitter systems. That gets people's attention. It changes hormones. It changes neuroinflammation. It decreases it. It changes the gut microbiome. And everybody knows that's related to mental disorders nowadays. It does all of these things that then get the attention of neuroscientists. So the really, hopeful thing is that since I've been doing this, there actually, to the best of my knowledge, has not been a clinician or psychiatrist. If I have at least 10 minutes to talk with them and kind of give them my spiel or tell them the story and the science, to the best of my knowledge, I haven't met one that has come away saying, well, this is impossible. There's no way this diet could do it. The first line of resistance I get from everyone who's not part of the low carb keto community. First line of resistance is, okay, Chris, you've got me convinced, but how the hell do you get someone to do this diet? That sounds really tough. I wouldn't be able to do this diet. So psychiatrists say this to me, I wouldn't be able to do that diet. How the hell are you getting a schizophrenic patient to do this diet? And then that's where the conversation has to shift to the art of this field. And how do we get people? How do we persuade them, motivate them? How do you make the diet palatable? What information do people need when they're starting this diet? Like, one piece of information I universally share with everyone is, you're going to be in hell for a week. Like, just plan on hell for a week and don't complain about how bad it is. I know it's going to be bad. I'll listen to you complain, but just, work with me here. Like, and then we talk about, like, well, why would you do this? Why would you put yourself through hell? Why would you give up all the delicious foods that you love? Well, because you have this horrible illness that's ruining your life. And our treatments aren't working. So you have a decision. Do you want to try something that has a chance of working based on my clinical experience, but also based on a tremendous amount of neuroscience literature, a lot of clinical trials in the epilepsy field? There are strong reasons to believe this should be considered, at least. Do you want to try this intervention that can work when pills fail to work? Or do you just want to remain with your illness and disabled? That's your choice. And when I put it like that to most of my patients, they're like, okay, I'm with you. Tell me what I need to know. Tell me what I need to do to get through this.
In a way, sometimes I've said it lots of times before, I feel lucky that I had such acute symptoms, which were cleared up by diet change, because they do come back quite quickly if I deviate in some way. I feel like people who sleepwalk into middle-aged obesity and pre-diabetes, or have subclinical low mood or background anxiety or something, even presented with that choice, they might take the food. And of course, that's their choice. But the feedback mechanism isn't as strong. It's perverse that such an acute set of problems might actually be a good thing in that regard.
Yeah. And so in the addiction field, we call that hitting rock bottom. You gotta hit rock bottom. So your circumstances have to be really dire and bad and catastrophic for you to give up an addictive substance. And I think with dietary interventions, even though I see the dietary intervention as a metabolic treatment, so I'm not necessarily saying I know a lot of people in our community are saying, oh, they're addicted to all the sugar and carbs and everything else. I don't even need to go there. But giving up carbohydrates and sweets and all the other foods is like giving up an addiction. It is. There's just no way around it. It is a dramatic change. Reward centers are being affected. Your cravings are affected. You have withdrawal. You definitely have withdrawal when you give up carbohydrates. And anybody who says you don't has never done a low carb diet. So people feel weak, dizzy, lightheaded, they're craving, they are having physical symptoms as a result of giving up carbohydrates acutely. And so I use more of an addiction model to think about it. And it really is, people have to hit rock bottom. And if they haven't hit rock bottom, if everybody's saying they're okay, if they lost 5 pounds, they'd be good. Their doctor's telling them, well, you can take a pill for that high blood pressure. If you can't lose weight, I'll prescribe you a pill and it'll be as simple as that. And they're like, well, I can have my cake and eat it too, so to speak. And okay, I'll go ahead and just take the pill. And then things have to get pretty dire for them to want to make a change.
I know we've not got much time left, but I wonder if your mental health has improved on a low carbohydrate diet.
Yeah, that's the thing that actually set me off on using it in treatment-resistant depression. Is when I first went, I went on it because I had metabolic syndrome. And I had noticed, I had high blood pressure, prediabetes, sky high triglycerides, really low HDL, somewhat high LDL. And my doctors was increasingly pushing pills and wanting me to take pills. And so I did it, and it worked for the metabolic syndrome. That got better within a couple of months. But the thing that I noticed was a dramatic change in my mood, energy, confidence, sleep, other things. And that's what started me on the path of, gosh, I wonder what this would do for all these treatment-resistant patients who've tried dozens of medications, ECT, psychotherapy, all sorts of other things, and nothing's worked for them. I wonder what it would do for them. And sure enough, lo and behold, it worked for some of them. Not all of them, but it worked for some of them. And that's what started me on the path.
So was that a doctor that recommended it?
No, I had to do it on my own. Interestingly, it was funny because my primary care doctor, I kept asking him year after year. He's like, "Oh, your blood pressure is getting worse." I'm like, "What am I supposed to do? Diet and exercise." "What diet? What exercise?" "Low fat diet. Go to the gym few times a week." I'm like, "I'm already doing all of that. I'm eating a super low fat diet. I'm doing all of it." He kept telling me that same thing over and over again. Low fat diet, exercise. I'm like, "I'm doing it." When I finally did it, at the time it was the Atkins diet. That's what it was called. That's what I did. So I come back in like 3 months later, everything, because he was like almost forcing pills down my throat at that point. And I'm like, no, I want one last ditch effort. I just want to try this crazy thing that I heard about. I probably won't work, but I just want. So I try the Atkins diet, go back in 3 months later. And he's like, "How did you do it?" And I said, "I tried the Atkins diet." And he leans in and whispers to me, "That's the only way I can lose weight too." I'm like, "You jerk. Why didn't you why didn't you tell me to try the Atkins diet if you thought it could help me?" And
so funny, but so sad.
But again, that was a time when we did not have the studies in the literature. This was 25 years ago. We didn't have nearly as many studies in the literature as we do today. And so I think he too feared losing his license.
Yeah, there's a good grounding now, isn't there, in not just the diet itself, but paleoanthropology and the logic behind really trying to, or understanding that if we do stuff that our ancient ancestors did, then that can be seen as likely healthy. And that's not what happened with my doctor. I went back and told her that all my problems had gone away because I changed what I eat, and she kind of smirked, as if either she didn't believe me or I'd never had that serious a problem in the first place, which is a real shame. The only sort of consolation was that I knew she was pretty close to retirement, so bring on the new batch. But
the new blood.
There's a comment in the Hyperlipid blog where he was talking about gluten and casein. I believe it's a post on that, and someone in the comments had said that they were breastfeeding and their baby had dreadful colic, and that they came away from gluten, and within 24 hours the baby's colic had stopped. And when the woman was delighted, obviously, because that ruins people's lives too, and she told her, I don't know if it was the health visitor or the midwife or whatever who she was seeing, probably the health visitor by that stage, of course, and the woman said, yeah, I mean, we all know that, but we're not allowed to tell mothers to come off healthy whole grains.
Yeah. So I'm taking, again, those are the things that I have seen clearly for decades. And I believe the only way we're really going to change the field is through science. So that is my approach. My approach was to dive ridiculously deeply into the science. And so I will at least do a preview and let people know. So I've got this book coming out Brain
Brain
Energy.
Energy, yep.
Comes out in November.
People can pre-order it, can't they?
They can pre-order it, but I'm just going to come clean on what the book is. So the book is not a book about the ketogenic diet. I mentioned the ketogenic diet probably 4 times. And it's in the introduction. So I think it will be a good way to sell the ketogenic diet, but it is not about the ketogenic diet. This book is about the broad question, what causes mental illness? And the thing that I will somewhat apologize for, or maybe whet your appetite with, for those inclined, it is a science book, for better or worse. I am trying to change the entire mental health field. The only way we're going to do that is through science. I can't say, the keto diet has cured several of my patients. Everybody believe me. Everybody start using the keto diet. It's great. Because if that's all I do, I'm going to get the same reaction that you got from your GP. I'm going to get the same reaction that everybody's getting. Yeah, we don't believe you. Yeah, you sound like a quack. Yeah, whatever. So it is a science book, and it is written for a lay audience. I really went out of my way to make it understandable, but it goes all the way to the level of the cell. You're going to hear about mitochondria. You're going to read about, lysosomes and autophagy and all sorts of things. And if you really hate cell biology and you really hate science and you really hate detail like that, I hate to say this, but maybe just don't buy my book, because you probably will be you will probably be overwhelmed, and or just won't like it. But if you really want to understand how we're going to change the mental health field and why mental disorders are metabolic disorders and what that really means and how we can actually get people better, I want to arm everybody, clinicians, researchers, the mental health field broadly, anybody from the diet community, anybody from the lifestyle fitness community who wants to be part of a solution to the mental health crisis that we have in the world today. If you want to be part of the solution, I want to arm you with an abundance, overwhelming amount of evidence that lines it up. There is just no way that this cannot at least be discussed. If people want to disagree with it, people disagree with theories all the time. Einstein came out with his theory. Lots of people wrote it off. He's pretty brilliant. I don't think I'm anywhere close to Einstein. So I'm waiting for the people to disagree, but I believe I have just highlighted so many problems with the way the mental health field works today. I have pointed out an overwhelming preponderance of evidence that mental disorders are related to metabolism and mitochondria, that it will at least have to be openly discussed.
Well, thank you so much for joining me today. Also, thank you so much for, doing this over the last 20 more years and biding your time until you felt like it was the right time, because it feels like a real labor of love. And I hope that you succeed soon in your major goal to change the mental health profession. I think it's ready to change. It just needs more people like you.
Well, thank you. I think that, the mental health field, anybody who is part of it, anybody who works in it already knows we have a lot of room for improvement. And I'm not trying to tear down what works in the mental health field. I'm trying to explain and understand, why do current treatments work? Why do our current approaches make sense? And why are we failing far too many people? What else could we do? What could we do differently? How could we think about things differently?
Yeah, this is something that sorry to interrupt you, but this is something that I really did want to make sure was mentioned clearly, that was implied by you saying that, the ketogenic diet isn't some sort of panacea. But I do want to say on the record that psychiatric drugs can be life-saving and are extremely useful and are well used by responsible doctors all over the world?
Some drugs for some people, and some, yes, absolutely. I have a mixed review of psychiatric drugs, and that will come out in the book.
Okay.
We know that, so my overarching premise, which you can read on the book, description, is mental disorders or metabolic disorders. And yet we know that many psychiatric drugs, antipsychotics, and mood stabilizers in particular, cause metabolic problems. They cause obesity, they cause diabetes, they cause premature death. And so I have done my best to explain how to understand that. Why would a medication that harms metabolism be helpful if the cause of mental illness is a metabolic problem? But it comes, so I feel pretty confident that I can explain that in a very understandable way. But again, you have to go down to the level of the cell and get into cell biology and all this other crap. So the book will take you on that journey. So you'll understand precisely why those medications can be helpful in the short run, but also why those medications might actually be keeping people ill in the long run. And there was just a New York Times Magazine piece the other day that really highlighted this issue. Patients who are taking antipsychotic medications are sick and tired of the status quo. They aren't getting better. They're getting fatter. They're dying earlier and earlier deaths. They feel like shit. They are zombies. And they are frustrated. The New York Times piece was a very long article on this issue. The World Health Organization has recently come out kind of in support of, yeah, these psychiatric medications are crap. they're not helping, and they might even be harming. And what are we really doing? We're spending all this money on these medications and people aren't getting better. Like, maybe we should just let people be. Just let them be crazy. Maybe being crazy and thin is better than being crazy and fat and sedated and a zombie. So these debates are already happening at organizations like the World Health Organization. Everybody is fed up with our lack of answers and our lack of ability to help people with mental disorders. Everybody is fed up, including mental health clinicians. They are equally frustrated. Nobody goes into mental health because they want to be a pill pusher. People go into mental health because they actually really deeply, genuinely care about human beings and human suffering. They desperately want to help people get better too. I want to give them scientific answers that will enable them to better help people. And one of those solutions will be something like the ketogenic diet. Again, not a panacea, not for everybody, but once you understand the biology and the mechanisms and the science, something like the ketogenic diet is a no-brainer. And lo and behold, gosh, we can help people lose that weight that they gained. We can help people feel better. They can get keto clarity. And guess what? It really doesn't cost too much. It's a lot cheaper than 5 or 10 psychiatric medications. If we look at what insurance companies are paying for those medications, gosh, we could afford a dietitian, a health and wellness coach, a clinician to spend a lot of hours with this patient, coaching them on how to do these lifestyle interventions. And we would still save money. And guess what? We would save money like threefold, because we would save direct costs. These interventions are cheaper than pills. The person is actually going to get better, be healthier, have fewer medical problems, they'll be less likely to have diabetes, less likely to have obesity, and all the medical complications that go into that we, the system, have to pay for. And God forbid, they might get better enough that they actually get a job and start paying taxes. Oh my gosh, we could have tax-paying citizens who desperately want to be tax-paying citizens. They want to have dignity and self-respect. They don't want hallucinations. They don't want crippling depression. They just want to be normal. And we could help them do that with more effective interventions. So this is like a win-win-win on so many counts. Now, the pharmaceutical industry is not going to be a winner here. I'm just gonna say I'm sorry that somebody is going to have to lose in all of these wins, but that's why we need a grassroots movement, because the pharmaceutical industry and the billions of dollars that go into pharmaceuticals, if they really understand the science and, oh my God, this Chris Palmer is now a threat, they're going to come after me. I'm going to have a bullseye on my head and back, and they'll come after me in terms of academic assassination. They will just try to discredit Chris Palmer. Chris Palmer is crazy. He's a quack. He is being, irresponsible by espousing these ideas, whatever. And there are powerful treatment systems in place that don't want to change. It takes change. Clinicians are going to have to learn new skill sets. Hospitals are going to have to develop new treatment programs, and all of that is change and money. And that's why I think we're going to need a grassroots movement. So for anybody who wants to join a grassroots movement and really change the mental health field for the better, stay tuned. Coming November, it is coming. And maybe it'll die out in a month, but I'm hoping not. I'm hoping I'll have someone join me, and we will do our best to try to change the world.
Well, I'll do whatever small part I can to join you, and hope to see the world that you described before you went into the darkness that is the machinations of the pharmaceutical industry. But let's leave it on the positive note that it will happen, and it will start in November. And I'll certainly be sharing this far and wide and telling all my doctor friends and acquaintances about it. So maybe we can catch up again in a year or two about how things have changed.
Sounds great.
All right. Thanks again, Chris. And what was the name of the book?
Brain Energy.
Brain Energy. Okay, everyone go out and pre-order it. Thanks again, Chris.
Thanks.